To perform a capillary sampling test, first make sure all of your capillary supplies are ready for testing. After pressing power, the cuvette holder should be moved into its loading position. The display will show 3 flashing dashes and the HemoCue symbol. Make sure that the patient's hand is warm and relaxed. Clean with a disinfectant such as alcohol and allow to dry. Use only the middle or ring finger for sampling. Avoid fingers with rings on them. Take the microcuvette out of the package. If a vial is being used, close the lid immediately. Using your thumb, press lightly at the top knuckle towards the tip. This stimulates blood flow towards the sampling point. For best blood flow and least pain, sample at the side of the finger, not in the center. While lightly pressing towards the fingertip, prick the finger using a lancet. Wipe away the first 2 or 3 drops of blood. Reapply light pressure towards the fingertip until another drop of blood appears. When the drop of blood is large enough to fill the microcuvette, fill it in one continuous motion. If the cuvette is not completely filled, discard it and fill a new cuvette. Do not refill. Wipe off any excess blood from the outside of the microcuvette tip, making sure no blood is drawn out of the microcuvette during this process. Look carefully for air bubbles in the filled microcuvette. If any are present, discard this microcuvette and take a new sample. Small bubbles around the edge can be ignored. Place the filled microcuvette in the cuvette holder. This should be performed within 10 minutes after filling the microcuvette. Rotate the cuvette holder into its measuring position. During the measurement, an hourglass will be shown on the display. After 15 to 60 seconds, the hemoglobin value of the sample is displayed. The result will remain on the display as long as the cuvette holder is in the measuring position. When operating on battery power, if the analyzer is not used, it will automatically switch off after approximately 5 minutes. Properly dispose of the cuvette following local regulations. To turn off the analyzer, press and hold the left button until the display reads off and the screen becomes blank.